Hi guys, I'm just going to wait for a few more people to join before I start. Hi Nikki. Hi Nikki. Hi Samnika. Hi Perry. Hi Serge, how are you doing?
Yeah, good, thank you. How are you?
Good, I'm good, thank you. So guys, this evening I'm really grateful and thankful to Dr. Kalsi for joining us. So he's an A&E doctor and he currently works at the Royal Surrey in Guildford. And at the moment he's obviously dealing with the current pandemic that everybody knows about, coronavirus. So I thought it'd be really nice to have Sojeevan join us to just answer some of our questions and to just give us a bit more of an actual picture from a doctor's perspective of how it actually is. So Sojeevan, thank you so much for joining us.
That's all right.
I know right now things are heavy and you must be absolutely mentally knackered, physically knackered, but we're really grateful that you're here. So yeah, first of all, how are you?
Yeah, so I'm well. I've had to, there's been lots and lots of changes around the whole country. The NHS has changed dramatically. Just a few months ago, there was everyone had a routine and it's completely changed. For example, they've changed our rota. We're on a new coronavirus rota. A lot of NHS have had to leave their families, including myself. So as you can see behind me, I'm actually staying in a hotel at the moment. Yeah, that the hospital have provided, which is I'm really thankful for.
Yeah.
But it's quite tough actually.
Yeah, I mean, how is it? So how does first of all, how is your rota different to what you're used to? And then secondly, how is it being away from the family and on a day-to-day basis having to go to work with this staring you in the face? I know how scary it is for us at home, and we're with our family. So how is that?
So firstly, in terms of the rota, they have changed it so that we're doing a little bit more so a few more days on. We have less hours, so one less hour actually on our shifts, because there has to be kind of like more doctors now, more nurses. So they've changed our rotas so that we are covering more hours. It just means that we have to work more days. So we have to work more weekends, more nights. We have to do more nights in a row. So before I was doing like two or three nights in a row. Now I have to do 4.
Wow.
So it's in terms of that. But to answer your second question about family, as you know, I'm a massive family guy.
Yeah.
So for me to leave my family was a big thing, but I've done it for my family as well, and to protect them. Because obviously I'm working frontline. I'm seeing people with this, with potential coronavirus, suspected coronavirus, every single day. Frontline. It would be too dangerous to go home. So I made that decision to just suddenly leave my home and take this place.
Yeah, I can imagine how tough that is. But as you said, it's for a greater good, and hopefully you'll also stay safe. And so I read today in the news that there's something like a quarter of doctors that are off sick, basically, or are in self-isolation, which is quite a significant amount given this week and next week is the peak. How is the NHS dealing with that, and what pressure is that putting on you guys?
It's putting a lot of pressure on us, to be honest. I mean, if someone has to isolate, they have to isolate. That's just how this thing is, how we have to cope with it. But I mean, as I've said, the rota changes. There are people coming in from other specialties, like one of my best friends who's a radiology trainee. He's at St. George's Hospital in London at the moment. He is actually now having to redeploy. So they're actually redeploying a lot of other trainees from other specialties to accident emergency, intensive care, and acute medicine, which are like the three big places where all of these potential cases go. Obviously, we're trying to get help, through NHS volunteers, the Good Samaritans website and stuff like that as well. But yeah, we're just trying to get as much resources as we can.
And gosh, it sounds intense. Have you noticed kind of A&E? I've read that somewhere as well, that A&E in general is a lot quieter with the usual stuff that people come in with, which is quite interesting because maybe on a day-to-day basis, people are maybe using it more than they probably should be. But is it most cases that you're getting are suspected coronavirus, or is it a bit of a mix?
So we've actually seen lots of changes in the last week in how our hospital, how our department is actually run. So on a day-to-day basis, there's literally changes every single day. In terms of phases, so we actually started on phase 1 where we would just have a couple of isolation bays for these patients, and then it turned to phase 2, which was actually the whole of our majors department converted into coronavirus section. We call it the dirty zone. So basically the patients with these type of symptoms, and now the whole of A&E. We're in phase 3 now. So we are seeing, we're basically treating everyone who comes through A&E as suspected cases. And we have to take precautions for that. Yeah, so it's just so many.
Yeah, intense. So somebody just asked a question about, have you been tested yet? Are you guys getting testing? How do you know that you're okay for yourselves, and also to stop the spread? What is happening with that?
Yeah, so in terms of our hospital, from what I know about our hospital only, is that we have not been tested yet. Unless we display symptoms, we will be tested. But things, as I said, things are changing every day. So there's plans this week and next week to possibly have everyone tested, and then hopefully when this antibody test comes out, I think that will be really important to differentiate between all those who have had it, who haven't had it, who can isolate, who can continue isolation, who can work, which is going to be key as well to fight this.
Yeah, just to know. So what does a typical day look like for you at the moment when you're at work? I know you said that it's
I can give you I can give you a kind of account of my day. I've just spent 4 days as the A&E registrar in the coronavirus zone. So my day would be to get past security. So it's basically very well locked down now, the hospitals. We have to show our security IDs. We have to get in there. Then we would have to go to the zone where we actually have to get changed into clean scrubs. We have to wash. We have to get changed in clean scrubs, and then we go to our rota. And on our rota, we see where we are deployed. So which part or which zone we're deployed in. Then we basically have to glove, gown, and wear our surgical face masks everywhere in the department now. And then we just see patients as they come in, come out. We have a consultant on the shop floor who we can ask advice from. We have very strict guidelines that we have to adhere to. So if a suspected COVID-19 case comes in, then we have to recognize how sick they are quite quickly, allocate them to different places and treat them as quick as possible.
Straight away.
Yeah.
With coronavirus, so some of the things that I've read are like, the person was okay and, they had a bit of a cough, a bit of a temperature, and they were fine for like 4 or 5 days, and then suddenly they just became very, very sick. So how would you know if somebody's coming on sort of say day 3 or 4 and they seem okay-ish? Would they be sent home, or would they be put in would they be in the dirty zone? Like, what would happen? How do you know?
Yeah, so the triage, so as I said, we have strict guidelines from public health.
Yeah.
Our consultants, everyone is doing research at the moment. And the guidelines suggest that oxygen levels are extremely important. And obviously symptoms are very important. So if a patient has high temperature, they have a high, because of that temperature, they've got a fast heart rate, they're coughing, they're basically, producing, we can see them producing this virus, then we have to take them into the cubicle zone to treat them. But we use a specific guideline where we have to do specific blood tests, we have to look at their oxygen levels, we have to do chest x-rays, and we can also use lung ultrasounds to firstly diagnose and also see how established this thing is and how severe it is as well. But day 5 in the symptoms is usually day 7 where we're seeing patients get ill, whether they either turn the corner, get better, or whether it's usually as you would know probably is the breathing that is affected the most. So these patients actually start developing pneumonia. Most commonly, it's pneumonia, which means chest infection, is on both sides of the chest. We're seeing that in most of these patients, and that is causing a lot of deterioration in these patients.
What is this might be a really silly question, I haven't got a medical background, but what is the treatment for it? Is it like antibiotics?
So viruses cannot be cured. Okay, there's no cure for a virus. The body has to fight it itself, and a lot of people can fight this thing. The problem is when they get secondary infection, or it leads to sort of this virus can attack the lungs. It can cause a lot of fluid in the lungs as well. So the treatments that we use are antibiotics because we're treating the secondary infections that happen. We're also treating them with oxygen because the most important thing in these patients, in any sick patient, is oxygenation of cells and tissues to prevent further organ damage. So we're trying to get as much oxygen to the lungs to try and get oxygen to not only their brain but their heart and their kidneys, which is where we're seeing the most damage. So a lot of these patients get kidney problems, and that's why they need organ support in ITU, in intensive care. So oxygen is very important. Antibiotics as a secondary kind of treatment is very important. And also ventilation is really important. So that's why they're trying to create ventilators and also these machines which try and blow as much oxygen into the lungs as possible.
To try and clear it. There's a few questions here, Serge. So one of the questions is, if somebody has had it, does that mean they will not get it again? That's something I cannot answer. We don't know. We don't know enough about this thing. There's so much research going on. I'm sorry, I can't answer that question. Okay, the next one is, what's happening with the PPE shortage for the frontline staff? Shouldn't everyone be tested like a lot of the countries are? I think you mentioned the testing already, but...
So the government is trying to get out the PPE as much as they can. It's not just about getting it out, but it's about getting out quality PPE. We have strict guidelines, and we have people actually watching us, like 24/7 now. Our consultants are crazy. They're like making sure that we don't touch our masks, we don't touch our faces, and if we do, we have to just de-scrub. We have to put everything back on. We have to rewash all of our hands. There's constant cleaners in our department now who are cleaning like crazy amounts, like literally every patient who comes in and out, they clean the cubicles. We call it deep cleaning, so they get out all their products. We have these wipes which we can use to wipe all the stethoscopes. We don't use our own stethoscopes anymore. We use the kind of ones that they give us. Goggles.
Yeah, so all that kind of equipment, every time you use it, you've got to clean it straight after.
Exactly. We have to clean it, but a lot of it is disposable, and we are getting the equipment. We are getting it in our hospital when we need it.
The manufacturing of it as well, isn't it? Somebody's just asked a question about, does hot steam work, like a hot steam bowl with a towel over your face if you've got symptoms and you've got this kind of, it's a dry cough though, isn't it? That it starts with.
So basically, it's a dry cough. Hot steam is going to help. It's going to help symptoms. It's going to help you breathe. It helps clearance. So the mucus, it sort of helps to break it up. So I mean, it's something that people can try. It's about relieving those symptoms at the end of the day. So even, for example, with paracetamol. The government have lots of research has strongly advised against ibuprofen, for example. But paracetamol, I would advise it to be used to comfort people, because the main thing is trying to, keep up your hydration, keep up your nutrition, trying to prevent this and trying to build your immunity as best as you can. So steaming can help. It's not a bad idea. It can help mucus clearance more than anything else.
So somebody's also asked about what's your thoughts on vitamin C, citric intake, and I've just lost that, and tonic water. I've jumped on the vitamin C hype, I'm not going to lie, just because I've read that that's meant to really help with boosting the immune system. Is that true? So there is research saying that vitamin C, zinc as well can all help. But my take on it at the end of the day is to having a balanced kind of diet, trying to eat as many vegetables and fruits as you can. Try to drink some orange juice. Juices are very good. So you can keep up your vitamin C. I know it's difficult in this country, but for those who have sun, trying to get as much sunlight as you can by taking that one sort of walk a day or some sort of form of exercise, these sorts of things, yeah. So okay, somebody's asked, they now say it's not just cough or shortness of breath, but also diarrhea as a symptom. Is that true? I think there's loads of other symptoms that they're saying could be related, isn't it? Like the loss of taste. Like if you can't taste properly, that they've said that might be a symptom as well. I guess. Yeah. So you probably don't know.
I mean, we as I said, there's still a lot of research going on. There's new publication evidence coming out every single day. Taste and smell is a new one. Diarrhea, vomiting. These can all be signs, basically. So my message is that if you're really struggling, if you're not coping, the main thing actually is your breathing and not being able to take in fluids. Like, for example, getting really, really dehydrated, you need to call for that help. So, if you're self-isolating and you get, really, really unwell in terms of you're getting dehydrated, you're feeling you're struggling to breathe, my advice is to call for help. Call that 111 or, call somebody.
Is it 111 that we should be calling? Was it 999? How do you know who
I mean, 111 is there for, advice. They're very good, and they can direct you to 999 if you need it. Hopefully you're not getting to that situation where you need to call 999 straight away, but if you do, then just do it. There's so many people out there who are there to help, and we're there for you if you need us. So yeah,
it's comforting for people to hear that. I think a lot of people just feel like, oh, I don't want to be extra, like I don't want to turn up there. But then I remember, actually, this is not related to coronavirus, but Sergeant, a few months ago, it was the day before my last event, I could hear him during the night, and he was kind of breathing like Darth Vader. It was really loud. And I woke Breatham up and I said, he doesn't sound right. Like, I'm really worried about him. And Breatham's quite chilled compared to me. And he was like, I'm sure he'll be all right. And I was just like, I'm going to ring 111. I can't sleep with that noise. It's scary. It feels like you can't breathe. I rang 111 really reluctantly because I didn't want to waste time, but they were just like, what is that noise? And I was like, that's my son. And they were like, put the phone down, ring 999. And there was an ambulance here within about 3 minutes. Yeah. And they were amazing. And sometimes you just think, oh gosh, I don't want to, not knowing. But I think, in this situation, if you literally cannot breathe and you're, like you say, dehydrated and you're feeling really unwell, then to call for help.
Just call. Don't waste time. Just do it. That's what it's there for. I mean, that's what this NHS is built for, and that's what we train to do. We're trained to recognize sick people and treat them as best as we can and as quickly as possible. So just call.
No, thank you. What is your hospital looking like at the moment? So I know from our local hospital today we had a message to say, absolutely no visitors now. If you've got an appointment, you come by yourself. There were lots of kind of basically really locking it down. What is your hospital like at the moment? Is it quite the same?
It's probably the same everywhere actually now.
Everywhere.
So a lot of, I think, all the routine stuff has been cancelled. I mean, at the moment it's holding up. We've got space for critical care beds at the moment. And also we are converting a lot of the wards, and there is one dedicated ward for that special ventilation thing I was talking about. We call it CPAP, which is this machine that just basically blows oxygen into you, because that's the main thing. But a lot of the routine stuff is cancelled now, and it's the same everywhere.
Go on, sorry, go on, Serge, carry on.
So we'll see, obviously the next, I think, 2 to 3 weeks is going to be, it's going to be quite intense, and we're going to see the peak and stuff. And that's where we're going to see what this is doing on all the other patients. Because we've got to remember that there are patients with other things going on as well.
Yeah.
We're obviously, there's people having heart attacks, there's people having strokes, everything is going on at the same time. So,
how is it dealing with that in A&E though? Like, you've had somebody that's just come in that's had a heart attack, and then you've got someone that literally can't breathe with coronavirus. How are you guys managing that, and what toll is it taking on you and the department? How is that? That must be quite intense, and you've obviously got to react quite quickly.
It's tough, but I've got to commend all my colleagues, all these sort of acute services that are running. So that we call it the cath lab, which is where they do the angiograms for heart patients. All the emergency acute stuff is still going on. So. I've got to commend all my colleagues for that. But from an A&E point of view, we are just getting on with it. I mean, that's doing what you would normally do, I guess. We're just doing what we're doing normally. We're just being extra precautious, obviously, with the PPE and all of the equipment. But we're just doing what we've been trained to do. We're just trying to help as much as we can. And I've got to commend all the nurses, and from the nurses, the radiology staff, even the porters are amazing. Like, some of these guys, they just work day in, day out. They're crazy, like, seriously, really good. So I'm very proud of, like, everyone at the moment.
Yeah, no, it's amazing to see, like, literally, the outpour of love from the country for the NHS, for frontline workers, for key workers, from the cleaners to the doctors to the consultants, it's been really heartwarming. And last Thursday when they did that clap for the NHS, I cried. It was just so moving. It was just so beautiful to see everyone just come together, because literally you guys are holding this country up right now. Like, everything.
Yeah, I think, to be honest, I think everyone is doing their bit. You know, obviously we're seeing in the news, there are people who are still not really listening to the advice from the government. But, you know, it's so important to listen to that advice, to stay at home at the moment while lots of research is going on, while they're doing the studies, while they're doing the testing and everything, because it's going to not only it's going to save our NHS, it's going to save people's lives. You know, this is not a joke. Like, there's a lot of sadness going around. And there's a lot of people who are not making it, and this is not a joke. People just need to listen.
How does that feel for you guys? Like, you're living away from your family right now. You're in a hotel by yourself after working flat out. Dealing with these cases, and I'm sure you've had to witness people passing. And then on the other hand, you're seeing people are still carrying on like normal. How does that make you feel?
It is really tough. It's why I say, like, communication is so important. Communicating to people about your feelings, about how you're doing, talking to your family, talking to your friends. I try and call everyone and FaceTime, and, you know, as much as I can. It keeps me going. Also, as everyone knows, I love music, and, like, I'm a tabla player, so I can't even bring my, like, tabla here, my drums, because I'm going to disturb, like, someone who's probably sleeping after a night shift. But I'm still listening to music all the time. But communication is key, and, like, trying to keep that positive mental attitude. It's tough, but...
How are you doing that? What sorts of things are you doing? You've mentioned FaceTiming and, you know, when you're with your tabla, playing tabla, or listening to music, because generally you're quite an upbeat person, but how are you... This is kind of probably the most pressured time you've probably had in your career so far, right? Like, it's quite intense, it's big, it's affecting the whole world. We don't know when the end is. What are you doing on a day-to-day basis to make sure your mental health is kept in check? Be it going for a meal, like, are you hanging out with your colleagues after work sometimes, or how do you stop yourself from feeling lonely? What are you doing to keep...
I'm a strong believer at the moment anyway, in terms of this isolation stuff and the 2-meter rule. I mean, we can't obviously maintain that at work, but then we have other precautions in place. It's about keeping your mind busy and active as much as possible. So at the moment, for me, I'm trying to work as much as I can, because that's what I've been trained to do. And I'd rather be on the front line doing what I know and knowing that I'm good at it and helping people to... Because you got to remember that we are sending a lot of people home, healthy people. We're not admitting... I mean, we're obviously admitting the people that need it, but we are sending a lot of people home. And
that's really comforting to hear, because I think the danger with reading the news or, you know, the articles that get shared on Facebook are predominantly kind of the scary, upsetting ones. We know quite a few people now who have lost loved ones, and it's it feels so real when you hear those stories. It's really tough. But yeah, so on the news, you're predominantly hearing about, the reality, the deaths that are taking place. And it's good to hear that actually, there are a lot of people that are also getting sent home. And is that even, do you have, this might be a silly question, so if there's a patient and they test positive for coronavirus, but they seem to be doing well, do you just get them to self-isolate at home, or do you keep them in the hospital until they're... Do you test them before they go home, by the way? That's another question, to make sure they don't have it anymore.
Yeah, so yeah. I was just going to say that currently we don't test patients who are going home. Even if we suspect it. That's just the policy at the moment in our trust.
Okay.
So we would only test them if they're admitted to hospital, because it does change the way we manage the patient in the hospital, but it doesn't change the way we manage the patient when they go home, if that makes sense.
So say the person's sent home, you suspect they might have COVID-19, but they seem to be doing okay, so they get sent home. Are they kind of told, if you deteriorate, you need to come straight back? Or...
Yes. So safety netting is massive. We have to be very careful. We give patients the leaflets. We point them in the direction of the 111, the gov.uk website, which has all of the best information on it, by the way. But if a patient deteriorates, then they have to call the 111 service and go through the process again. So we would never tell them to just go home and isolate and just stay there. If they get worse, then they need to come back. They need to call somebody and ask for help.
Okay, so there's a question here. Germany's been able to contact map and test quite regularly. Do you think the UK needs to test people more consistently? People seem unsure of whether they have it or not.
Yeah, there's a lot of uncertainty, and that's causing anxiety. I've seen a lot of patients with anxiety, which obviously causes anxiety. Actually causes or is a mimic of the shortness of breath, so that makes it difficult as well. That's why we do all of these other tests to completely kind of make sure that they're safe to go home. I think when the testing comes through and we know where people are and mapping them, etc., it's just going to make a massive difference. It's coming, it is coming. I've been listening to the news and we get messages and public health guidance and stuff, so it's just a matter of time, I think.
Where do you get most of your info from? Is it through the news, or is it through, you must have daily kind of catch-ups, or more frequently than daily, with your team? We see it every day. And secondly, we have, I'm pretty much sent like about 10, 15 emails a day about guidelines, and they're changing constantly. Every time I walk into the department, something's changed. Like every single day they changed something. Is it easy to keep up with that? Or is it quite like, oh gosh, what is it that I am not supposed to be doing right now?
Yeah, well, that's why there's someone very senior on the we call it the shop floor. There's someone always there to ask, and we are not afraid to ask in this situation for help. So that's what we do. But there are meetings every single day, like between the managers, the head of nursing, the head of the doctors, surgeons. It goes throughout pediatrics. They're trying to change everything all the time for the better.
That's good to hear. So we're expecting the peak this week, next week, and potentially the following week. What is happening in terms of support levels during that peak? I know they've called back lots of retired NHS workers, and also, pulling people in from different departments. Do you feel that there is sufficient support to be able to deal with this peak? Is it kind of like everybody's holding their breath, or is it kind of we're just going with the flow and it's going to be okay? How what is the mood like? Because this is kind of what everybody's waiting for and hoping and praying it kind of calms down after or there's a better handle and there's less stress on the NHS. What is the mood and what is the sense within hospitals around that?
The mood is still very positive. Especially, in my department, we're all very positive. We can see the changes, the changes that they're doing to help this. I've seen it on a day-to-day basis. Obviously, they'll have to open up more wards. Obviously, that they built that the massive big Nightingale. They're building that Nightingale hospital in London. Everyone is helping. The military is helping. I've already met loads of through the NHS volunteer scheme. I've met loads. They've actually started working in our department as well. So,
that's amazing.
I think collectively, we'll get through this. It's going to be a challenge, but everyone, in London, my friends, if they listen to if people listen, especially staying at home and stuff, and listening to the basic advice, basic yet strong advice that the government is giving, we will fight through this, and we are positive. We are quite positive at the moment. The mood is very positive.
Somebody's asked, there's lots of thank you messages. You'll be able to read these after, Serge, if you're not able to read them now. But
I'm not actually reading them, to be honest.
It says, on the note of patients that are getting better, why do you think the media are not showing the good news about recovering patients too, than just all the doom and gloom? I wish they would also share that. Do you think they're not sharing it so much because otherwise the people that are walking around are kind of going to think, oh, it's fine, it's minor, we'll be able to... Is that why? I don't know. Why do you think
I don't know. I think they should be... I'm an honest person. I'm seeing a lot of good cases as well. I think probably that there is a little bit of that. They have to kind of to scare the public a little bit, but they're doing it because they have to. Because this is, as I've said before, it's not a joke. This is a very serious condition. Not just here, it's obviously around the world. This is so serious. People are losing their loved ones because of this. So I'd rather the public are just scared and just stay at home. Just listen to that advice.
Yeah, just stay at home. It's not hard, is it? We get to be at home safe with our families.
Yeah,
it's not really a big ask. Somebody has asked, is your hospital part of any C-19 clinical trials as far as you are aware?
I think all hospitals are putting data forward. There's data going through to public health every day. It goes towards the testing trials and everything. But the bigger hospitals in London, like Imperial and St. George's and things, they're doing the bigger trials. Somebody's
asked, can you elaborate on what constitutes an underlying health condition, please? I think there is a list online, isn't there?
There is a list that I would advise everyone to go to. The underlying conditions could be anything from previous breathing conditions, like asthma, people who've been chronic smokers, COPD, to people who have, cancer, who are on, the chemotherapy drugs, to patients who have immunity dysfunction. But it's all out there. It's all on the gov.uk website. Diabetes is also a big one as well, heart problems. It's difficult to say because they're still doing so much research, but the current advice is all on the websites. It's all on the public health websites and NHS websites.
Let me just see. Sorry, I'm just seeing if I've missed any questions because there's lots of comments here. Okay, I think
I
I've
could
got all
just
the...
say to... Yeah, I mean, I was just going to give a little bit of advice to everyone.
Yes, I was going to ask you if you've got any tips, any advice, any... For me, personally, I feel like you've put my mind at ease a little bit in terms of it isn't, kind of completely frantic. There are people that are recovering and that, for you're just doing your job. It's just that fear of, are the NHS staff okay? Are they coping? What is it like? I mean, I'm sure it's very stressful, but from what you said, your mindset is, I'm doing my job. This is what I have been trained to do, and I'm doing my job, which is good to hear. Like, it's reassuring that that's how you feel from your side. But yeah, if there's any kind of advice that you can give us at home, or if we do develop symptoms, it would be really good to hear that.
Okay, so let's start with this is all about trying to prevent this thing as much as possible, catching this thing. The most important thing is hand washing. Okay, we've heard it millions and millions of times, but I'm going to keep saying it because it's so important. But hand washing, clean water, soap, it's the only way you're going to get rid of this stuff. Try not to touch your face. Yeah, I know it's difficult. We always but if you do that, and you then subconsciously kind of you know that you've done it, just go wash your hands. Isolation, so stay at home. It's very, very important. There's 2-meter rule. There's a reason why that happens. So I don't know if you know, dominoes all stacked up. This was on TV the other day. It was really good, actually. So dominoes stacked up, if someone's got it, and then it's like a ripple effect, because then everyone will get it. But if you take those dominoes out in between each one, and you hit the first domino, it's not going to hit the next one. So then all of the other dominoes stay upright. So all those people are going to be okay. So isolation is very important. Ventilation. So ventilate your house. Keep your windows open. Leave it. I've told my family this as well, and I tell everyone. But keep them on if your window has like this single latch, just do that in every single room. Okay, just leave some aeration, some ventilation. Make sure you eat healthily, as I said, because that's where you get your minerals from, your nutrients, your vitamins, including your vitamin C and all your B12, all of these sorts of things. Keep active as much as possible, because that will build your immunity. So try and do as much exercise in your house, and obviously if you can go out one time, then go for a nice solid walk, even if it is with your family members. Try and keep that 2-meter distance. And for those people who this is going to be a bit of a big one, but those people who drink alcohol, I would advise you to reduce that. Because it will help you sleep better, actually, and sleeping promotes healthy immunity. So try and cut that down. Please try to stop smoking. I know this is really difficult, but for some people, because they smoked all their life, they feel that it's a way to relieve stress, even with drinking. But please try to cut down smoking. And music is very good for your mental health. Music is very good for physical health, because you can dance. I've got a really good friend who's very good. She's a dancing doctor, Dr Nerja. You can follow her on Instagram. But communicate with people, communicate with your family, communicate with your friends. Try to relieve some of your thoughts. Just put them on somebody else. Let them help you in your decision making, in your thinking, and then obviously I believe in God, so I pray. I pray every day. My Tabla is also a form of meditation, and these things help. all of these things. This is how we can improve our mentality, which improves our physical health, which improves our immunity, which will prevent this thing from spreading, prevent this thing from getting worse.
It's really, really helpful tips. Really helpful. I didn't know about the ventilation thing. I'm like keeping all the windows shut because I'm scared like coronavirus is going to jump in. So I should probably leave the windows ajar. There's a couple of questions there, Jeevan. So one is, hi, I have a question. If you have kids who are very clingy, do you keep the distance from them, hugs and kisses? I mean, I've still been cuddling my kids because we've all been together. We've not been out.
No.
Is that fine?
No, you can't. Listen, it's very difficult to. You can't do that with kids. You just can't do it because kids are meant to be clingy, and this is and love is such an important thing. For them to grow and to be happy, because happiness is like health as well. Happiness and health.
I agree, and I think yesterday, Arjun and I, after 2 weeks of being at home, to the point where I was starting to think, oh my gosh, how am I actually going to leave the house? Because I've now become terrified of leaving. I think my biggest fear is Sergeant getting something. But Arjun and I went out, and normally people will kind of cross the road, and like to not walk past. But yesterday, I don't know why, we had his scooter, so it was a bit of a faff trying to cross or whatever. But people kind of passed us. It was very quick. But he was just like, am I going to get coronavirus? And I was just like, oh my gosh, I don't want you to have this fear. But at the same time, I need you to understand. But I think if we don't give our kids that love and affection right now, we're not giving them that security. Because as much as they're kind of doing their own thing, as much as they're kind of embracing this time being at home with the family, I think it's quite scary for them as well. It's something different, something that they're used to. So I think, we haven't stopped hugging them.
Are you okay back there?
Yeah, can you hear it? It's okay. It's a false alarm. I think they've burned something.
Oh no. So teaching. I better go wash my hands now. Teaching children. Teaching these things to children is vital because then they can understand better. But trying to stay away from your own children, it's not going to help. It's not going to be advisable. And you've got to remember that research so far has shown that kids who do contract this thing have less severe symptoms and do a little bit better actually. So.
And there's another question. Any advice for when we do essential shopping? Should we cover our faces and wear gloves?
And so the government advice is... I'm reading.
Sorry, there's just people asking if Britham's just made dinner. No, I made dinner before I started this.
In answer to that question, so the government say... I mean, I've actually printed this off, and this is what they say about that. So if you don't mind, I'm just going to read it.
Yeah.
We do not recommend the use of face masks as an effective means of preventing the spread of infection. Face masks play an important role in clinical settings, but there's very little evidence of benefit from their use outside of these settings. That's from the gov.uk. But, use it, but then you've got to remember that you need to make sure you clean the things. I've advised people to actually clean products that they bring into the house and then obviously wash their hands. At the moment, that is the current advice.
There's been some strange things that have been sent around on WhatsApp with people that have COVID-19 spitting on food in supermarkets, and I'm like, oh my gosh, talk about sending me into a paranoid state. So yeah, it is a bit, I guess even when we get an Amazon delivery, I'm just spraying it with Dettol before I bring the box in, and I don't know if that would work or not. But
you got to remember, most people, and a lot of people, obviously most people don't want to get this. So these companies, We've already seen how much they're doing for the NHS, but they're doing so much for their own products and for their own stuff. So they've all got their precautions in place as well.
Yeah.
So you got to remember that they are all trying to help. They're all trying to help in this fight.
That was really, really useful. Has anybody else got any questions before we end the call? How are the family doing? How are your parents without you being at home? They must be quite worried. Or are they keeping...
My mum
they're probably feeding off your energy as well, isn't it?
Yeah. So it's all about positive mental attitude. My mum and dad are like, I love them to bits. They are keeping me going through this as well. They are like crazily positive. I mean, my dad is like, this is what he's taught us from day one. He's taught me to be positive, never give up. And my granddad as well. He said that he believes in karma, and I'm doing this for there's a reason. I'm doing it for a reason. So I've just got to say that without my family, it would be this would be an impossible fight for me. So that's why family is so important.
Yeah, I know Samika and Perry have both been saying they really miss you, and they're really, really, really proud of you. And I know literally everybody's rooting for frontline workers, and we're so, so grateful for everything that you guys are doing. We appreciate that it isn't an easy task. We're sitting at home feeling kind of, anxious about it, and you guys are literally living this. This is your reality right now. So we're so grateful. Somebody just asked another question. Just one question, please, regarding symptoms. If you have just been suffering from headaches and chills, can that be worrying?
So just monitor. So, if you do get the headaches and chills, then try to isolate as much as possible. As I said, make sure that you're doing everything that you can to keep hydrated and to keep ventilated, and make sure your breathing is not going to get affected, basically. If you start feeling that any of these things are getting worse, then please call for help.
That's really helpful. It's a shame you don't have your tabla with you, because I would have asked you to do a little jam.
Oh, really? I would have actually.
Live, that would have been quite nice. There's lots of messages saying thank you. People feel a lot more kind of calmer. They feel calmer, and it's been very informative. So thank you so much, Sajeevan. Please stay safe. And it will be great to maybe catch up in a few weeks and see what the situation looks like now, because like you say, every day is changing. Samika's just said that they can leave your tabla outside your door, by the way.
Oh, okay, yeah. Well, I hope that they have a reason for the police if they get stopped. Just be careful.
But thank you so much. And we'll catch up soon. Thank you guys for joining as well.
Yeah, please be safe and just be positive and listen to the advice, because that's the most important thing. But be safe. Yeah. But thank you so much for everyone's praise, and I've got to say thank you as well to everyone out there as well for respecting us, and thank you to all my colleagues for being amazing as well.
And I'm sure they feel exactly the same way about you. Thank you.
It's all teamwork, This is all teamwork. Everyone in the world, this is teamwork.
And that's the thing. There's everyone's got to work together to combat this, and it's not just us; it's the entire world going through it. So it's comforting in some ways, and it's really distressing in other ways, because there's no kind of escape. But we'll get through it, I'm sure.
We will do. You too.
Take care.
Best of luck to the family as well, yeah?
Thank you, Angie. See you later.
Bye.
Bye.